Hi everyone, this is my cardiovascular SOAP note. So JT, 52-year-old Caucasian American female, presented to the office alone and as a reliable historian. She presented to the office stating, "I have a heavy period, passing golf ball sized clots for the past 8 days." So history, she started having periods when she was 15, bleeding every 28 days, just heavy one day, and then starting her cycle over again. The past year, she's been spotting daily right after her boyfriend died. She's also had the past 3 blood pressure readings in the office meeting hypertension criteria. She's taken Midol that takes away the minimal pain that she's been having, but nothing seems to make the bleeding worse or better. She's been having to bring extra pants to work because she's bleeding through them, a pad every 45 minutes, and she's been waking up in the morning in a puddle of blood. So past medical history, generalized anxiety, no hospitalizations, surgeries, no allergies, no medications, family history, denies knowing mom having any medical conditions, dad died in a motor vehicle accident, and she denies knowing any medical conditions he had. Same with grandparents on mom and dad's side. She has 4 kids, and she denies them having any medical conditions, and same, she doesn't have any siblings. So review of systems, constitutional, JT reports lightheadedness when she stands up and being fatigued, sleeping most of the time when she's not at work. She denies any fevers or chills. Cardiovascular, she reports periodic chest pain and denies shortness of breath or leg swelling. Respiratory, she reports shortness of breath when walking and when thinking about her boyfriend. Reproductive, she reports heavy bleeding for the past 8 days with daily spotting for the past year. Social history, she's widowed. She had a husband for decades, then he died in a motor vehicle accident. She's had a boyfriend that died about a year ago. And no sexual history past that. She lives with her boyfriend's parents. No alcohol ever, never smoked, has an office job, and no medical insurance, just cash pay. So onto objective vital signs: heart rate 94, blood pressure 142/90, temperature of 97.6 Fahrenheit, respiration rate 24, height of 5'5", weight of 133. That puts her BMI at 22.1, statin at 93% on room air today. Physical exam, constitutionally, she's sitting in the chair, pale and in obvious distress, crying. Respiratory, clear breath sounds bilaterally in all lobes. Reproductive, pap smear done with large clots noted, no obvious other irregularities. Cardiovascular and elevated blood pressure today with a weak regular rhythm, no extra heart sounds in office. Hemoglobin tests came back at a 6. So differential diagnosis, we're focusing on the hypertension. Given her consistent blood pressures, she's had one about a year and a half ago, and then a year, and then today 140s over 90s, both above that, and then with chronic stress and inactivity, it makes essential hypertension likely. And then the other differential diagnosis would be secondary hypertension. She has a diagnosis of generalized anxiety disorder, amenorrhea. These could be signs of hyperthyroidism, but she hasn't tried any medication yet, and we haven't gotten a TSH on her, and she hasn't checked her blood pressure outside of the office. And then the last differential diagnosis would be elevated blood pressure without a diagnosis of hypertension, white coat syndrome. It could be that we only get high blood pressure readings in the office. She's worried about costs, about bleeding to death. It's less likely than the other two because it's been consistently high every single time she comes in. So the primary diagnosis is going to be essential hypertension. So the plan with the hemoglobin of 6 is to get her to the hospital for blood transfusions. Diagnostics, we want a CBC. We were trying to keep the cost down with just a hemoglobin, but we need a full CBC and then a thyroid function test and a pregnancy test. Treatments, we're going to do lisinopril 10 milligrams, iron to help with any anemia for menstrual bleeding, and then estrogen to help emergently with the bleeding. Education, we're going to talk about the excessive bleeding, how it could lead to anemia, that we need to get her blood pressure checked at home, and that the side effects of the iron supplements can be constipation, and she needs to take them by themselves, and also have some vitamin C to enhance absorption. We're going to follow up with her in 4 weeks to reassess her blood pressure, to make sure we can get her down to a target goal. Thanks for watching my video. Thanks.